Hello everyone. Today, we're delving into the details of a medication called Pralsetinib, commonly known by its brand name, Gavreto. As always, this discussion is for educational purposes only. If you have any health-related questions or concerns, please consult a medical professional. Description: Pralsetinib, marketed as Gavreto, is an oral medication that falls under the category of RET inhibitors. RET, rearranged during transfection, is a gene that, when altered, can contribute to cancer growth. Gavreto works by targeting and inhibiting the abnormal RET proteins, which helps to prevent the growth of cancer cells. Approved by the FDA in 2020, Pralsetinib is primarily prescribed for the treatment of certain types of cancers. These include non-small cell lung cancer, NSCLC, with RET gene fusions, medullary thyroid cancer, MTC, with RET mutations, and other types of thyroid cancers with RET fusions. It is particularly used when the cancer is advanced, has spread to other parts of the body, or cannot be removed by surgery. Warnings: Pralsetinib has its set of precautions. It can cause serious side effects, including liver problems, high blood pressure, and bleeding. Patients should be monitored regularly for these conditions. Gavreto can also affect the body's ability to fight infections, so it's important to be aware of symptoms such as fever, chills, or other signs of infection. Additionally, Pralsetinib can cause lung problems, such as interstitial lung disease or pneumonitis, which can be serious and potentially life-threatening. If you experience new or worsening cough, shortness of breath, or chest pain, seek medical attention immediately. Before taking this medicine. Before starting Pralsetinib, it's essential to discuss your full medical history with your healthcare provider. Inform them if you have any liver or kidney problems, high blood pressure, or any history of bleeding disorders. If you are pregnant, planning to become pregnant, or breastfeeding, it's crucial to discuss the potential risks with your doctor. Pralsetinib can cause harm to an unborn baby, so effective contraception should be used during treatment and for some time after the last dose. Men with partners who are pregnant or who may become pregnant should also use effective contraception during treatment and for some time after the last dose. Pralsetinib should not be taken if you are allergic to any of its ingredients. Before starting the medication, inform your doctor if you have had any lung or breathing problems, as these conditions can be exacerbated by Gavreto. Regular monitoring, including blood tests to check liver function and blood pressure, is advised during treatment. Side effects: Like all medications, Pralsetinib can cause side effects. Common side effects include constipation, diarrhea, high blood pressure, fatigue, and muscle pain. Some patients may experience more serious side effects, such as liver problems, which can present as yellowing of the skin or eyes, dark urine, or pain in the upper right side of the stomach, bleeding, and severe high blood pressure. Patients should also be aware of the potential for more serious side effects, such as interstitial lung disease or pneumonitis, which may present as new or worsening cough, shortness of breath, or chest pain. Additionally, Pralsetinib can lead to infections, so it is important to report any signs of infection, such as fever, chills, or sore throat, to your healthcare provider immediately. Interactions: Pralsetinib may interact with other medications, which can affect how it works or increase the risk of serious side effects. It is important to inform your healthcare provider about all the medications, supplements, and herbal products you are taking. Some medications, such as certain antifungals, antibiotics, and seizure medications, may interact with Pralsetinib. Dosage: The correct dosage of Pralsetinib is crucial for its effectiveness. Always follow your doctor's recommendations when taking Gavreto. The typical dosage for adults is 400 mg taken orally once daily on an empty stomach, either 1 hour before or 2 hours after a meal. Your doctor will determine the appropriate dose based on your specific condition and response to treatment. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. If you miss a dose, take it as soon as you remember unless it is less than 12 hours until your next dose. Do not take 2 doses at the same time to make up for a missed dose. Avoid. While taking Pralsetinib, it's important to avoid certain activities and substances that can exacerbate side effects or interact with the medication. Avoid consuming grapefruit or grapefruit juice, as it can increase the levels of Pralsetinib in your blood and lead to increased side effects. Given the potential for dizziness and fatigue, exercise caution when driving or operating heavy machinery until you know how Gavreto affects you. FAQ: Many wonder about the age restrictions for Pralsetinib. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That concludes our overview of Pralsetinib, known by its brand name Gavreto. Remember, this information is intended to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.